Imagine this. You're sitting around the table eating dinner with your friends and family, when all of a sudden you see a family friend grasp their chest. Out of instinct, you immediately call 911, and the paramedics arrive, revealing that your friend's artificial heart valve is malfunctioning. On the way to the hospital, the paramedics are diverted to a hospital 35 minutes away. Your initial instinct is to blame the hospital because you're confused as to how they could have no room for your friend. However, this is not the case. In fact, you soon discover the hospital's patient and data system was being held for ransom as a result of a cyber attacker. Thus, the hospital was unable to accept incoming patients. Hi, I'm Janet Vogel, Chief Information Security Officer at the U.S. Department of Health and Human Services. So how do we combat attacks on medical devices, as well as the various other threats, such as ransomware, social engineering, and much more, that the healthcare and public health sector is facing? This is a challenge Congress tasked us with back in 2015 through the Cybersecurity Act, in order to build a more secure infrastructure to our health sector. In response to this challenge, Department of Health and Human Services, or HHS for short, established a public-private partnership initiative known as 405D. This aligns the healthcare cybersecurity approaches whose mission is to create, manage, and lead all industry-led processes to develop consensus-based guidelines, practices, and methodologies to strengthen the healthcare sector's cybersecurity posture against cyber threats. This initiative is led by both federal and private partners, where members of what is called the task group collaborate and identify gaps in cybersecurity awareness and tools. These members then take these gaps and break off into smaller groups and create products that help build a more resilient community within the healthcare and public health sector. To date, the most notable resource produced by the task group members is the Health Industry Cybersecurity Practices publication, sometimes referred to as HICCUP, which consists of the main document, 2 technical volumes focusing on small and medium and large organizations, and a resource and templates document. This publication was produced to provide the healthcare sector an initial blueprint on ways to cost-effectively help mitigate cybersecurity risk within small, medium, and large organizations. So what does all of this mean? Well, for starters, cybersecurity is a shared responsibility. Healthcare organizations are increasingly transmitting data electronically through mobile devices, cloud-based applications, medical devices, and technology infrastructures. And it's up to our public and private sector experts to effectively raise cybersecurity awareness, as well as building the necessary tools to equip our HPH workers with the necessary means to protect patients. Information security officers, healthcare practitioners, and executive personnel all have a role in protecting patients' medical and personal digital data. Cyber threats are an ever-evolving challenge, and it takes the whole healthcare sector to combat these assailants. We at HHS are committed to joining our sector through programs like 405D in this fight. Most importantly, everyone needs to remember that cyber safety is patient safety. Produced by the U.S. Department of Health and Human Services at taxpayer expense.